As a whole, we're lower. Not the averages are in the 28-30% range. So
And how many people do we have dedicated to just that process? The rehiring process or the hiring process? Just two?
yeah, just Cindy, and then Scott, was hired on in the last year. Yeah.
Thank you. Did anyone else have any questions on that report?
I had one.
Yes, Joe.
The report mentions that that PMC has updated its presence on the Petersburg Chamber of Commerce website to enhance our findability. Has that has that borne any fruit yet? Has anyone expressed interest in any positions through looking through the Chamber of Commerce?
I wish I could answer that. Cindy's traveling, so she'd be the best person. I can get back to you on that, though.
Oh, okay. Thank you.
Yeah. In general, it's been very challenging filling open positions. So
New facility report.
Can you hear me?
Thing from Jay there?
This is Jay. Can you hear me?
Just barely.
Turn the volume as high as it'll go.
That's much better.
Okay, you're at 100%. So I believe there was a one-pager in your packet that has some bullet points organized by the Wellness Center portion of the project and the main hospital portion of the project. We have also participating this evening, if there are questions for them. We have Roy Roundtree from the architectural firm, so he could speak to questions on the design if the board has any questions. And we also have Ben Kuhn from Dawson Construction, who could speak to construction issues and or the big dig, as some people are calling it. So just to go through the bullet points on the Wellness Education and Resource Center portion of the project, that standalone building just west of the main hospital, the proposed new hospital site, is at 19,000 square feet now. It grew a bit because of the Treasury grant requirements. And the short story there is some of the spaces that were originally in the main hospital building were pulled over to the work building, which is a lower cost building in general. It satisfied some requirements of the Treasury grant, and then obviously then decreased the overall size of the main hospital building, which I'll get to in a minute. The 35% design drawings for the work were completed in late September. We started site work, as I'm sure everybody knows, there in Petersburg in mid-November. They've made good progress. They're currently on hold because of weather. They were down for the holidays, and then the weather came in, so they haven't restarted yet. We're hopeful that they will restart. Talking to Rock and Road, they projected perhaps week after next. But if you have more questions on construction, I'll let Ben speak to that. I don't want to steal his thunder. The actual $20 million from Treasury, which is coming through a state DCRA grant. So the money flows from Department of Treasury to the state, and then the state subawards to PMC. That grant was signed by Phil on December 21st. Merry Christmas. Looking forward, the design team is now working on the final plans for the work building. They'll have a package out in mid-February for things like steel that need to be ordered and some of the mechanical equipment that's long lead that needs to be ordered. The 65% drawings and specifications are due March 22nd. final design documents due 7 June. And with the long lead items and the 65% documents, Dawson anticipates starting actual building construction in May of this year. Moving on to the main hospital building, as I mentioned a minute ago, some of the functions, support functions, as well as a few clinical things like public health nursing came out of the main hospital and wound up in the work building. That was a plus in the eyes of Department of Treasury. The main building now is 59,000 square feet. In general, the inpatient, both LTC and acute care, is upstairs along with ER, and then downstairs is primary care and outpatient services. 12 acute care beds, 16 long-term care beds. The 35% documents for the main building were completed mid-November. And we're studying those documents right now. The site work for the main hospital is going to be completed, even if we don't get funding for the main building shell and core through the state this cycle. We do anticipate completing the site work so that the project is shovel ready. That always helps funding. The key bullet, the last bullet on the main hospital building, is there is an ask supported by the borough of 37 million to the state legislature to do the first part of the main building construction, which we're calling shell and core. Last point I'll make before opening it up for questions is there is an open house, the second open house to inform the public on where the project stands. That is scheduled for January 31st from 11 to 7 in the Borough Assembly Chambers there. It'll be an open day where people can come in and hear a couple presentations throughout the day, look at poster boards and ask questions. That's all my prepared remarks. Be happy to answer questions or turf any questions specific to design to Roy or specific to Ben to related to construction to Ben. And I see Jason's also on the call. So if you have any questions from a financial standpoint, Jason could answer those.
Thank you, Jay. Any questions? No questions from the board. Thanks
Great.
again for
Well,
that report. Yes, I said thanks
yeah,
again for that report.
Sure. Yeah. Look forward to seeing people at the open house.
Yes, thank you. Okay, I guess we'll move on to quality and infection prevention. Have any questions on that report? Seen that the Cedar Social Club is off and running, and it sounds like they have a couple of folks that are regulars there already.
Yeah, yeah. We're working through it. There's been a few hiccups as we're going, but they're working through that, so.
Questions on that? Executive summary.
Any questions? Karen, maybe could turn my mic down just a little bit. Thank you. Any questions on my report before I dive into some highlights? So the big thing that Jay had mentioned since we met last is the signing of the Treasury grant, which solidifies the funding, which is has been quite a process with the regulatory side of things, and we're very excited that that's going forward. Obviously that, those funds will be made available as we need to make, invoice payments. So, it's a little bit of a relief that that's all through. Let's see, the assembly voted on the number one on a priority list, which, both on the federal and state side, and we had reached out to Senator Stedman's office for a February 6th meeting. And, earlier this week, the Borough Assembly voted to, have, Bob is going to be joining us, and the mayor will be, in Juneau, also joining us with the lobbyist. And so we'll have a team there. Jared will be, coming, and just advocacy for the hospital. The difference here that I think is really important with this meeting is Jason's going to be coming with us to talk about the funding and the financial aspect of critical access hospitals specifically. And I think that's going to be a huge asset, to an understanding and education process, which, when I talk to legislatures, that legislators don't seem, it's very hard to understand the critical access hospital funding and what that means. So that's exciting. We're also, looking at the workforce or the, work session, in a couple of weeks, and we're putting an agenda and packet together for you all. Remind you, if you have anything that you want me to add to that agenda, make sure you email me. And, again, we'll focus quite a bit on new facility and then funding. Jason's coming down for that meeting, for that week as well, to, spend some time talking about the funding aspect of a critical access hospital, long-term care, cost-based reimbursement, Medicare and Medicaid. And then, we have the open house on the following day. So it's going to be a little bit of a packed schedule. But also we want to capitalize on the people present. I believe Roy, is Jay coming down as well. So it'll be good to have some team members available on site for that work session and the open house meeting for the public, which, the last time we had that was in, I think, April or May. I can't recall. And things have changed a little bit as a result of the Treasury funding and the parameters that were defined, by Treasury on the design and the impact to the design. So that's something we want to make sure the community's well aware of, and everyone's on the same page. Let's see. Jason and, our auditor will cover the finances pretty thoroughly, so I'll leave that to them. Jay covered the new facility. We did have the groundbreaking. Thank you for those that attended. It was a good turnout. Tough day, but that's kind of nice to have that, that feeling. And I'm glad that the weather held out, honestly. I mean, now it's a little bit of a challenge. It's shut down until the weather clears up. So there's lots of snow and there's some ice. So we need to, get that green light with the weather, and hopefully that's coming in the next couple of weeks. I do have this, I pulled the statistics up just, for the question on the workforce. So every year, the Alaska Hospital and Healthcare Association puts a salary survey together. We're not able, it's proprietary. We can't disclose that. It's internal. It's an internal document, but it's how we set our rates here. It looks at all the critical access hospitals in the state, and it's a really great survey that looks at, staffing, workforce, and they've added turnover rates to that. And so I can just go over that just to give you a sense of not just what's happening in the nation, but what's happening in Alaska with other critical access hospitals, and regular hospitals in the state. So the average percent of turnover as a whole for all employees is 28%. And again, Cindy had calculated 20% or 21% for us. They define it further by discipline or departments. And so the highest turnover rate looks like it is dietary services at 39%, which actually is pretty consistent. We have a really tough time in that area within our facility as well. I don't know the exact percentage. I don't believe it's that high, but again, that would be something we'd want to drill into a little bit more. Followed by social services, it looks like, are 33%. Top level executives, 31%. Environmental services, 28%. Nursing is 29%. So you can see that by department, you see the turnover rates are pretty high. So I think that looking at those from a relevant standpoint is really important. Relevant meaning Alaska, and relevant meaning critical access. So anyway, I just want to provide that in real time since you asked. All right. Going back to my report, groundbreaking ceremony, the newsletter we had sent out, going back to December, we had Eula bucking. We had the KFSK PMC Live. Cindy, thank you for attending that today. And work session to look forward to, open house. We have some trainings going on related to mental health first aid. We had some de-escalation training and suicide training that's coming up, this QPR training, they call it, and really want to thank the staff for putting that together. Not sure if you've heard, but Bristol Bay experienced an active shooter that fortunately didn't cause any harm to anyone, but it was a pretty scary incident from what I hear. I don't have all the details, but I just heard about that today, just maybe last Sunday that it occurred in their ER with the, somebody that was a spouse or a boyfriend related to an employee. So in any case, just makes it pretty scary that close to home. Scopes are occurring this week. So specialties has been a big focus of PMC, adding access to care, primary care, specialty care. Search is providing our collaborative agreement with surgeon Dr. Garrison, and she's here for her second visit along with Kelly. I don't remember her last name, Gebler, CRNA, and that team has been excellent, working with our staff. They started at 6 in the morning and working late into the night. I think I see them leaving at 9 p.m. Last night. Right, they're right, and they to try to get everyone in. So that was really it's really great. And then I think today and tomorrow, Kelly's also a pain specialist, and so she's providing a pain clinic. So did I add on a day and a half of that, which is we're hoping to continue that as well. So that's really great. We're looking at orthopedics with someone out of Juneau Bone and Joint, and we're also looking at some more opportunity with search and some other facilities and specialties, and that are escaping me right now. Courtney, what am I missing? I mean, optometry, of course, is coming, but right. Yep. Right. That's what. Yeah. Psychiatry is actually working for us through a HRSA grant, and then we have PA French. We're reaching out to him to try to schedule for dermatology. Those are my highlights. I put some volume information there. Nothing really earth-shattering. We're definitely seeing this last year. We're seeing that graph. It's a kind of a small graph, but it kind of looks back from February of 2022 to now, and there's a dotted line on it's really the patient outpatient visit encounters, and those are looking at a much higher level of appointments and that usually equates to access and improving access. So, and then of course our LTC days have been up as well. So, and that's my report. Any questions? I might have missed a few things, but.
Questions for Phil? Thank you, Phil. Okay, financial report.
This is Jason. Thank you for the opportunity. We had a great finance committee meeting here yesterday. We reviewed the November and the December financial statements. Just a few highlights to point out to the full board. So in November, when we completed the cost report, it identified that Medicare owed PMC $664,000. And so that was recorded in the month of November, even though that had much to do with the performance for fiscal year 2023, but we had already finalized the audit and things of that nature. So that was recorded. It's being recorded in fiscal year 2024. So year to date, the financial performance of the organization in terms of net revenues as well as operating income is above budgets, looking well. Our volumes in most areas are strong. Home health is a little, it's different now than what it was during the pandemic. There was a strong utilization of home health during the pandemic, but post-pandemic, those volumes are returning to normal. But we're seeing strong inpatient, long-term care, urgency department, outpatient in terms of Medicare, radiology lab. Therapy's down a little bit because we're down some staff. So we do have some extraordinary payments that are due to the facility. We expect to receive in the next 3 to 6 weeks. One of those is the $664,000 from Medicare, which will be followed up by a year-to-date correction, probably another $300,000. We're also still waiting for a payment from the state of Alaska with regards to the rate review that was performed. They increased what they're paying us on current claims as of December, but they owe us a back payment from July through the 1st of December. So in total, we add that up to about $1.3 million that is expected. Cash is okay right now. It's not great. We're caught up with our vendors. We're not holding too much, but hopeful to receive that and continue our work to reduce days in AR. So things are going well. And later in the evening, we'll have the report from our auditors, Donald Haney, and we had a great experience with them and appreciate their contributions to the financial reporting and financial performance of the organization. Any questions on the finance report?
This is Marlene. I have a question on the November revenue and expenses. Could you talk a little bit about line 7, bad debt expense?
So yes, each month we complete a model that otherwise identifies based upon the accounts receivable that is outstanding, what do we need to have in reserve for contractual allowances and bad debts. And when we put that information in for the month of November, because we had collected some claims in the previous months, written off some claims in the previous months, it identified a credit that needed to be recorded there. So a reduction in the expense that we were reporting year to date. So that's why you're seeing a credit there. And then you're also seeing the $664,000 for the prior year adjustment of the cost report.
Go ahead, Joe.
Yeah, this is Joe Stratman. Jason, I just had a question actually. In Phil's report, he talked about in the financial wellness section for fiscal year 23 benchmarks, key performance indicators for gross AR days to be less than 55, DNFB to be less than 5 days, and 90 days of cash on hand. I just wondered, could you maybe tell us where we're at on those metrics now and sort of what the trends are for the near future?
Yeah, I'd be glad to. So just to clarify for everybody what that means, the financial statements report days in AR on a net basis. So that means it's reducing the contractual allowances out of there. I find that misleading. And so you'll often hear me report to you a much higher number, which is gross days in AR. When I began working with the organization back in February and March a year ago, there was a large amount of accounts receivable still outstanding on the CPSI system. And our gross days in AR were at 95. They were in the mid 90s. We've been able, in working with our business office and with HRG, to reduce that down to the low 70s. We would like to see that, and industry standard would be to see that on a gross basis below 60. There are accounts receivable that needs to be worked more attentively by the team. We've been trying to put the resources towards that, and we've had a few other, like I said, the cleanup of the CPSI system. We also are working hard to meet a deadline in terms of reviewing our credit balances and refunding any credit balances to the public, so that we can meet some requirements on what's called unclaimed property with the state of Alaska. So we're making progress. We're halfway where I would like to see us. Still working hard with the team, but not quite there. You brought up the topic of DNFB. That means discharge not final billed. So it's an indicator of how much of our revenue is not billed out the door right now. When we began this process, it was at 15. We have it down. It bounces back and forth between 7 and 9 days. Has a lot to deal with completing the documentation by the providers and staff, completing the coding, and then getting the claims through the edits and getting them out the door. The last couple months, we've been finalizing some new charges in the system, dealing with colonoscopies and some of the new services. And so we've been holding those claims until we know that they're accurate. And so that has caused that DNFB to be a little higher than what we'd like to see it. It's in the 7 to 9 range. We'd like to see it between 5 and 7.
Thank you.
Any other questions for Jason? Thank you. Moving on to board committee appointments. Last meeting, we had started this process, but because Kim and Micah were not present, we didn't want to fill all the positions without them having the opportunity to have some input on it possibly. And so it looks like we still have openings in community engagement, evaluation committee, bylaws committee, and Kinderskog advisory committee. And I was curious if either Kim or Micah had a desire to be on any of those committees.
I'm finding it difficult to get off in time for a, in the middle of the day kind of committee. So that's kind of where I'm standing right now.
How about you, Micah?
I'm fairly open. I do have a brand new baby, but I am happy to fill a hole where there's a need.
Okay, so I guess I would open it back up to the full board on some of these deals. If there's anyone that wants to be on some of these additional ones that aren't already.
Having sat in on the Kinderskog meeting, I wouldn't mind participating on that one.
How about bylaws? Right now, it's myself and Stratman. Anyone else interested in bylaws committee?
I could also help with that one. That's not going to be something we're going to be changing every 5 minutes, so I certainly could help out.
Evaluation committee. Myself and Cushing are on that presently. Anyone else interested in that one?
That's usually done a lot by email and not, you don't have to be somewhere at a meeting.
Okay.
I can participate in that if there's an unmet need there. This is Micah.
Kim expressed an interest in that one, but would you be interested in community engagement?
Sure, that'd be great.
Okay. So if we have Kim on the evaluation committee and Micah on the engagement committee, does that have them all filled, Karen? Okay. That should take care of that. And then Cindy had indicated that she could do a quick report on the
On the Kinderskog, and I apologize. I was not entirely prepared to give a report, and so I had to collect my thoughts. I sat in for Kim on the last Kinderskog committee meeting, and some of the things that we discussed were, we talked about the benefits to the community and to Kinderskog of the collaboration with the hospital. We talked about priorities for access to the program and the potential for opening up spots for additional participants. Right now, as far as staffing goes, we're kind of at a maximum. Many participants, we discovered, do not use the program every day, and summer is a period of time when, of course, it's especially in demand for participants. We talked about who in the community is served and how best to meet the community need. And we also talked about attendance requirements. There are some students who are enrolled who actually don't always show up. And so we need to address that issue and maybe let those kids fade out of the program to allow access for people who would be more actively participating. And so those are just a few of the things that we discussed during the course of the meeting.
Thank you. That report? Okay, moving on to new business and the audit report.
Donald, yep. Don, you're up.
Okay. Thank you for having me. My name is Don Haney, and I'm the audit partner on the job. We used our Juno staff to help out with the audit process, Eric and Jordan. The audit process was 2 weeks long. We did an interim week at the end of July. Eric and Jordan actually went to the facility and went and tested transactions and did compliance. You guys did have to have a federal single audit this year, meaning you spent more than $750,000 of federal funding. So we did a federal single audit over COVID funding. There was 2 different compliance programs. There was a construction grant as well as provider relief. During interim, we go through and test major classes of transactions. So this is over financial statement reporting. So we have to test controls over financial statement reporting as well as controls over compliance. So over financial statement reporting, we went through and tested 40 different cash disbursements, which is your accounts payable. We tested 40 different payroll transactions. We tested 40 different medical billing transactions, 40 cash receipts. We also looked at your credit cards and tested 40 different credit card transactions. And we also looked at material transactions. So any cash disbursement or journal entry over $50,000, we reviewed for supporting documentation as well as authorization. And within those systems, we didn't find any errors. So we didn't have any findings related to the internal control test work or financial statement reporting. And then we also pull separate samples for compliance test work as well. So we had samples for those major compliance programs that we also did compliance testing on. And so is what I plan on doing is going through the letter of the governing board. I don't know if you guys have this stuff in front of you, but there's a letter of the governing board and there's some set of financial statements. And I wanted the letter of the governing board is some required communication that we're supposed to do with the board. And so I was just going to hit some of the highlights within that document. And then there's also 3 different opinion letters within the financial statements that I was going to go through each section and kind of discuss the differences between these letters. I don't believe you guys had I don't know if you've ever had a federal single audit, but I know you haven't had one in the last couple of years. And so the audit report is going to look just a little bit different than probably what you're used to. And then there's also within the audit report kind of a summary page that really will summarize everything that I've discussed. And so the letter of governing board is the first one I'm going to go through. And so this letter is important. This is where we would discuss really anything that we wanted management or the board to know about. And then there's also specific communications that we need to discuss. So the first paragraph just says we audited the financial statements, and it's the different standards that we follow. So we have to follow generally accepted auditing standards, government auditing standards, and uniform guidance. I don't remember last year if your audit followed government auditing standards. But since you did have a single audit, we had to follow government auditing standards. So there's 3 different sets of standards that we follow. Uniform guidance is your federal compliance standards. The next section is significant accounting policies and transactions. So it's just noted that the significant accounting policies are in note 1 to your financial statements. There was no new accounting policies adopted this year. It looked like last year, Max helped you guys adopt the new lease standard as well as the subscription-based standard. And I guess I didn't mention Max, but Max helped out with the transition. Max Mertz was your prior auditor. He let us review his work papers. We went through his work papers. He also gave us a mapping of prior financial statements. And so he uses the same audit software as we do. And so it was a fairly smooth transition of transitioning those financial statements into our software. So we were able to write those financial statements effectively and efficiently. There were no transactions during the year for which lacked authoritative guidance. And they're all significant transactions were recorded in the financial statements in the proper period. Another thing that we need to discuss with the board is any accounting estimates. Accounting estimates are a big part of the audit. We go through and make sure the estimates are reasonable. One thing you guys were just discussing was accounts receivable. We go and look at the allowance account that is assessed against your net realizable value of accounts receivable, just to make sure that it is reasonable. We also look at the estimate for your useful lives and the calculation of your depreciation expense. We also look at the estimate for the proportionate share of collective net pension and OPEB liabilities and assets related to the deferred outflows and inflows of resources. And that is based on the information that the state of Alaska gives us for that the actuarial reports. And with the new lease standard, you have there's an estimate for the right to use asset and a lease liability, which is based on the estimated incremental borrowing rate. Financial statement disclosures, there was nothing that I thought we should highlight in the letter of governing board for financial statement disclosures. There were no difficulties encountered in performing the audit procedures. There was no uncorrected misstatements that we'd have to put on the letter of governing board. There was a few adjusting journal entries. There was a $1.8 million adjustment to get net position to match the previous year's financial statements. And the remaining 4 entries, those are the entries that are posted based on the information that we get from the state in order to book your deferred outflows and inflows and the change in your OPEB assets and liabilities. So those are pension journal entries. There is no disagreements with management. Management had to sign a rep letter dated December 4th. And really that rep letter just attests to the accuracy of the financial statement information. The next page, if you guys are following along, the letter of governing board, there was no consultations with other independent accountants about our audit opinion that we are aware of. Internal control section, we'll talk more about the internal controls when we get to the financial statements. There's sections in the yellow book letter or the gas letter that talks about internal controls over financial reporting. And then there's a section in your uniform guidance letter that talks about internal controls over compliance. There was no other findings or issues that we noted. We did assist in the preparation of the financial statements. However, management for those financial statements is responsible for the drafting process of those financial statements, and they have to take responsibility for those financial statements. Other matters, you guys do have RSI in your financial statements, and that's the information right behind your footnotes. And we did not audit the RSI and do not express an opinion or provide any assurance on this RSI. But we did reconcile that information back to the financial statements. And really that RSI information really just comes from the reports that we get from the state and KPMG's audit of the state pension and OPEB. There is supplementary information in your financial statements this year, and that is your federal schedule of expenditures. That is a required schedule for when you do a federal single audit. And we do have to put it in relation to opinion on that letter or on that schedule. And so that is included in our audit procedures. And so that is a summary of the letter to governing board. So now I'm going to go to the financial statements. And on page 1 of the financial statements, this is our audit opinion. And we'll kind of just go through each paragraph quickly and discuss what this letter means. The first paragraph discusses what we audited. So we audited the financial statements of Petersburg Medical Center. The second paragraph is our opinion. So this is an unmodified opinion, which means there are no material misstatements that we are aware of within these financial statements. So in our opinion, the financial statements present fairly in all material respects, the financial position, and the changes in the financial position and its cash flows for the year ended. So that is the type of audit opinion you want when you're looking at a set of financial statements, is you want an unmodified opinion, which means there's no material errors that we are aware of within these financial statements. So basis for our opinion. Like I said before, we conducted our audit in accordance with auditing standards generally accepted. And for this portion, we followed government auditing standards. As we noted in the letter governing board, we also followed uniform guidance, but that's in a separate letter. This is just a letter over your financial statements. We are required to be independent of PMC, and we're required to maintain that independence throughout the audit process. The prior period financial statements, these financial statements were audited by other auditors. Like I said, Max Mertz, who we worked with, to get this first year set up and to get it rolling smoothly. The next page, responsibility of management for the financial statements. So of course, management is responsible for the preparation and fair presentation of these financial statements. And they're also responsible for the design, implementation, and maintenance of internal controls relevant to the preparation and fair presentation of these financial statements. And so a big part of our audit is the concentration of internal control testing. And that's kind of why we split this up into 2 weeks. The first week is all that internal control testing. And then the second week was in October, where we did more substantive procedures, going through the balance sheet accounts, tying that to supporting documentation, as well as analytical and substantive procedures over the income statement. So also in preparing the financial statements, management has to review if there's any going concern issues, and that's something that we do as well, to determine if the organization can continue for 12 months beyond the financial statement date. And our responsibility. So obviously our responsibility is to obtain reasonable assurance about whether the financial statements as a whole are free from material misstatement. Reasonable insurance is not absolute insurance. So there's not a guarantee that an audit will always detect material misstatements. In performing an audit, we exercise professional judgment. We identify the risks of material misstatements. We obtain an understanding of internal controls relevant to the audit. We evaluate the appropriateness of accounting policies and significant estimates. So that bullet point right there is a big part of what we do. We go and review the accounting policies, document the different procedures, and then go through a testing process. And then once again, like I said, we also have to evaluate if there's any going concern issues, which there were not. Otherwise, you'd have a separate paragraph in this audit letter that talked about going concern issues. Required supplementary information. This is the proportionate share of the net pension OPEB liabilities and schedule the center's contributions for the PERS Retirement Center and any notes to the RSI. And once again, we did not express an opinion over that. The supplementary information is your schedule of federal awards, as I noted before. And the very last sentence of the supplementary information paragraph, this is the opinion over that schedule. So in our opinion, the federal schedule of expenditures is fairly stated in all material respects in relation to the basic financial statements as a whole, which means there's no material errors that we are aware of within the federal schedule of expenditures. And because you had to follow government auditing standards, you have this additional paragraph. And really is what it means is the purpose of this report is solely to describe the scope of our testing of internal controls over financial reporting and compliance and the results of that testing. So there's a whole separate report that talks about government auditing standards. So on the next audit report to go over is page 41 of the financial statements. And this is what they call the yellow book letter, or the letter in accordance with government auditing standards. So this letter really focuses on internal controls over financial reporting. So in planning and performing the audit of the financial statements, we consider the internal controls over financial reporting as a basis for designing our audit procedures. So as we go through and testing internal controls, this is how we determine the assess risk of controls. Since we had no errors, we assess control risk at low, and then we design our audit procedures off that. There are two different types of deficiencies that we would report in your in this report if they existed. The first one is a material weakness, and this is a deficiency or a combination of deficiencies in internal control. So there's a reasonable possibility that a material misstatement of the entity's financial statements will not be prevented or detected and corrected on a timely basis. So this would be if there was some sort of material error within the financial statements that was not detected by the organization. The booking of the OPEB and pension stuff, we don't consider that a material misstatement, because for the most part, that stuff comes from KPMG's audit report, and we take the actuarial reports and plug it into a spreadsheet to help produce those journal entries. A significant deficiency is really just anything that we want the board to be aware of. And then the last paragraph on this page, it does state, during our audit, we did not identify any deficiencies in internal control that we consider to be material weaknesses. The next page, report on compliance and other matters. What the point of this paragraph is to discuss if there was any fraud or abuse, or if there was any question cost material to the financial statements. And so the last sentence of this paragraph says, the results of our test disclose no instances of non-compliance or other matters that are required to be reported under government auditing standards. So we are not aware of any fraud or abuse, and we are not aware of any question cost material to your guys' financial statements. The very last letter to talk about is the uniform guidance letter. And the first paragraph just says, we audited compliance for any program and that any compliance requirement that is direct material to the major compliance program. The second paragraph is our audit opinion over compliance. And once again, this is an unmodified opinion, which means there's no material non-compliance of the major programs that we looked at. We're not aware of any material non-compliance of any major programs that we looked at. So in our opinion, PMC complied in all material respects with the types of compliance requirements that could have a direct and material effect on each of its major federal programs. Basis for our opinion, once again, we followed generally accepted auditing standards, government auditing standards, uniform guidance. And under the federal single audit, we're also required to be independent from PMC and maintain our independence. So this letter is very similar to the audit opinion over financial statement reporting, but it's just oriented toward compliance. The next page, once again, management is responsible for compliance and designing those controls to ensure that they are in compliance. And we go through and test those controls to ensure that they are in place, and also test compliance to make sure there's no non-compliance. And again, we obtain reasonable assurance and not absolute assurance. On page 45, this is a separate section for report on internal controls over compliance. And it's very similar to internal controls over financial reporting. They got the same two types of deficiencies. material weaknesses and significant deficiencies, which are defined the same way as we just did. In the next paragraph, we do state that we did not identify any deficiencies in internal control over compliance that we consider to be material weaknesses. And on page 46, this is a summary of pretty much everything that we discussed. This is a quick place that you can go look and see what your opinions are, if there was any significant deficiencies, material weaknesses, if there was a going concern, if there was any question costs. So the first section is the financial statement section. We gave an unmodified opinion. There was no going concern issues. There was no material weaknesses. There was no significant deficiencies. There was no non-compliance material financial statements, which that would be like if there was question costs that were material. Under federal awards, there was no internal control issues or there's no material weaknesses or significant deficiencies for internal controls over major programs. There was no material non-compliance. For the 2 programs that we audited, we gave an unmodified opinion, which means there's no material non-compliance that we're aware of within those 2 programs. The next one is there's no findings of question costs. Here's the 2 programs that we audited, 93.493 and 93.498, community project funding and provider relief. The dollar threshold for A and B is $750,000, and that's just an audit term for us determining what programs we're going to audit. And you guys did not qualify as a low-risk auditee because you have to have 2 years of federal single audits in order to qualify as a low-risk auditee. And the difference between high risk and low risk is the amount that we have to audit under CFA. And that's all I have. There was no financial statement findings. There was no federal award findings and question costs. Is there any questions over the letter governing board or the audit reports?
Any questions? And thank you for that. I don't see any questions. Thank you for that in-depth report.
All right, thank you. You guys have a great meeting.
So do I have a motion to go into executive session to consider medical staff appointments and reappointments?
I so move.
I'll second.
All in favor?
Aye.
Aye.